Hello and good evening. Welcome to Anupali. Thank you so much for spending another Sunday evening with me on this program. It is my pleasure every week to spend this hour with you where we can talk about the advancements we are making in every area of national development. This past week, we announced a new organizational structure for the teaching service. Under this structure, there will be a new and upgraded positions for secondary schools in our country. These include the role of principal, deputy principal, assistant deputy principal, heads of departments, senior graduate teacher, senior qualified teacher, and of course, school counselors. The new structure is expected to promote a higher level of professionalism among school staff and provide them with new opportunities for career development and upward mobility. Teachers will now be charged with more responsibility and receive a corresponding increase in compensation. This increase will amount to over $1 million in salary allocation for teachers on an annual basis. $1 million more will be budgeted from this fiscal year for the secondary schools in the country. I believe this decision reflects our commitment as a government to the professional development of our principals and teachers and to the ongoing review of the public service to foster increased efficiency and accountability. All of these changes, no doubt, will benefit our students as well. Another important decision taken this week has far-reaching benefits for all our citizens. After extensive review, government decided that effective September 1, 2021, we will increase the minimum wage in Dominica. This increase applies across all wage categories. The review was undertaken after extensive consultation with relevant stakeholders, including international partners such as the International Labour Organization. The new minimum wage order is another indication of this government's preoccupation with improving the livelihoods of the most vulnerable among our citizens and creating the right environment for our people to progress. These measures are being implemented at a time when revenues are down and the economy is stressed due to the impact of a worldwide pandemic. However, I believe these decisions by the government are necessary to secure a better standard of living for all our people. Last month, in the Parliament, we passed the Dominica Hospitals Authority Act, which governs the administration and management of hospitals on the island. The new hospital authority is charged with improving efficiency and service delivery to our citizens and implementing best practices to promote the health and welfare of the Dominican people. I have invited the new Chief Executive Officer of the Dominica China Friendship Hospital, Dr. William Dexter James, to speak with us today on the new administrative structure and how it is expected to impact the delivery of healthcare. I am also joined by Dr. Roosevelt, the hospital medical director. Good evening and welcome to Anupali, Dr. Blah and Dr. James.
Good evening.
It's a pleasure having you here. Now, Dr. James, you are new to Dominica, having assumed the leadership of the Dominica China Friendship Hospital in January of this year. For the benefit of our audience, tell us a bit about your background and the work that you have done in healthcare.
Okay, good afternoon, listeners. And Prime Minister, thank you very much for inviting me to share with you my experiences in hospital reform and hospital administration. I'm a citizen of Trinidad and Tobago and Barbados. My education is, I'm a certified accountant by profession. I have extensive training in hospital administration. Indeed, my doctoral studies was done in public sector reform, with specific reference to health sector reform. I've I've done extensive work at the regional level, supporting regional governments in their own reform agendas. And I've also provided technical support to regional agencies such as the Pan American Health Organization and Accreditation Canada International. I've been a CEO for hospitals for the last 2.5 decades. I started in Trinidad and Tobago in 1995. And so I've been a CEO in Trinidad and Tobago, Grenada, Anguilla, Barbados, spent a few months in Cayman Islands. So in short measure, I am a practitioner. I'm also a policy maker. And as a result of the work I've done over the last 25 years, University of the West Indies Faculty of Medical Sciences in 2018 conferred upon me Professor of Practice in Public Policy and Healthcare Administration. So, in short measure, that is who I am as a Caribbean national.
So you're coming for a wealth of experience and knowledge in public health management. Now, how would you summarize your duties and functions as the CEO of the Dominica China Friendship Hospital? And of course, that will be extended to the other hospitals as well.
Yes.
Please.
Yes, sir. My role could be defined as follows. First of all, is setting the strategic direction in terms of, our broad mission, vision, and values. What is this credible future we're trying to create for hospitals in this country? And so my role is to essentially develop that strategic direction and make sure we share that with the rest of the staff and the community. The second really is building organizational capacity in terms of good financial strength, good operating systems, good public image, most of all. Yet another area of responsibility includes the whole question of improving operating performance. And this performance is not only at the organizational level, indeed it transcends the entire organization. So we've developed, for instance, a performance management instrument for our boards. Boards have to do self-assessment as to whether they're discharging their responsibilities in terms of the governance arrangement. But more specifically, my responsibility is to ensure that we could deliver in accordance with the plans and programs against a set number of metrics by which we could evaluate whether the hospital is performing or not. And this is at the corporate level and at the individual level. And then finally, the issue around change management and managing the change. This is big. This transformation the country is going through is fairly big and really requires a careful workout of the various processes and activities so we could have a smooth landing. So in a general sense, that is my role as CEO.
Thank you. Now, Dr. Blah, you're better known to our listeners and our viewers, but tell us a bit about yourself and your functions at the Dominica China Friendship Hospital.
Okay, good night, PM, and good night to our audience, and thank you for having us here this evening. Well, as most people would know, I'm from the village of Massac, married with 3 beautiful daughters. From a professional point of view, I'm a graduate of the University of the West Indies, Mona campus, and I specialized in obstetrics and gynecology, which obviously focuses on women health and women care. And currently, I am in the position of Hospital Medical Director at the hospital. The HMD has essentially a twofold role, if you want to call it that.
And the HMD is the
Hospital Medical Director, right. HMD is involved in administration. HMD sits on the management team and is involved in overall management decisions that are taken. But in addition, I also have oversight for clinical operations, services delivery. So all of the clinical services, the oversight for functions of doctors, and how clinical care is actually administered at the hospital also fall under my responsibility. Of course, as a practicing physician, I'm also directly involved in patient care, specifically in obstetrics and gynecology patients, but also because of this overarching responsibility, I do get involved in other clinical cases.
Thank you. Now, Dr. James, you took up the role of the CEO as we prepare to bring to Parliament the Hospital Authority Act. How have you been preparing for the implementation, though, of this new administrative structure?
Right. Essentially, what I did over the last 6 months was to see where my learnings and experiences of reforms elsewhere could be contextualized to what I refer to as the Dominica model. And so a lot of my time was spent on working with the National Health Commission on the legislation. Let me say at the outset that I really want to commend Dominica for its approach, because Dominica took a particular orthodox approach to how we would develop reforms by setting up, in the first instance, the National Health Commission, which provided focused attention on specific aspects of the reform process. So I worked with the Commission in fashioning the legislation itself, working on, for instance, the composition of the board, issues around the financial provisions, how we will transfer and transition staff from the public service to the new entity, issues around how do we improve public accountability, within the system, the overall organizational design that is fit for purpose. We cannot now have delegated functions of finance, human resources, and service planning with an organizational design that we now have. So those were areas that I've worked extensively with the interim board to fashion the act so that it is fit for purpose, and one that has a design that is aligned to the business processes that have been delegated to the board.
Oh,
yes.
Now, based on your previous experience in hospital management, how will the new hospital authority change the way that healthcare is administered here in Dominica?
Yeah, it's a good question, PM. And it's not only unique to Dominica. Elsewhere in the region, there's a power imbalance between those who provide care and those who receive care. Patients don't feel they have a say in the way the care is administered. And so Dominica has to adopt what we refer to as a patient-centered care model, where we, for the first time, make this patient the center of all we do. We got to treat patients with dignity and respect. Patients must have a say in the care and treatment provided to them. They must also know the diagnosis and treatment. Families must be able to set up meetings with our physicians and have meetings with the doctors. So the move towards a patient-centered care model is critical. Patient satisfactions are important. When patients speak about a good or bad experience, it has very little to do with the outcome. Dominica has had very good outcomes, contrary to what some may say with respect to its health care. When you listen about what constitutes a bad health system, it is the interaction between our nurses and doctors with patients, not being able to talk to our doctors, the environment of care, quality of the meal service. Those are the kinds of issues that patients will really raise concerns about in terms of the care. So they move towards a change in that dynamic by shifting the focus more for patients having a say in the way the care is delivered to them is a fundamental departure from the existing system.
Okay. Now, Dr. Blanc, you were part of the Health Commission that was charged with developing the Hospital Authority Act. How do you think, from your vantage point, this new structure will change the way we run our hospitals here?
Okay, so there are going to be a number of advantages. And the public, I believe, should be reminded that the Act did not just come from the air. There were a number of consultations done. There were a number of hearings. And the Commission and the interim board essentially listened to what the concerns of the public, the end users were. And some of that, or I believe a lot of that, is reflected in the new Act. So some of the advantages would include, obviously, greater autonomy. Everybody is aware the public service is very layered, and there are a number of persons you would have to go through before a final decision is taken, sometimes on a critical, urgent, important area. And so we should be able to have much quicker responses, especially to emergencies, etc. We have also, I believe the new system gives the increased ability to implement proper rewards and recognition programs. In addition, it also gives the increased ability to set in place programs where persons who are